Good morning, good afternoon, and good evening. Welcome to today's webinar, Protecting Healthcare Workers During a Pandemic, a moral, health, and economic imperative, jointly hosted by the Africa CDC and Jhpiego. Discussion on this important topic. Next slide. My name is Alain Damiba. I'm the Senior Vice President, and I will be the moderator for today's program. The global COVID-19 infection rate has surpassed 6 million, with nearly 376 deaths. Countries in Africa experiencing an increase in the number of those sick and dying, which is a major concern to governments, health workers, and the public. On a continent that is home to 20% of the global community and carry more than its share of the burden of global diseases, the role of health workers is uniquely challenging across the health service spectrum. Ensuring the health of communities with limited resources require the uniquely African response of resilience and sacrifice. The expanding pandemic presents further challenges to Africans. Health workers are expected to protect themselves and their families, ration the limited resources at their disposal, educate the concerned and frightened communities, and provide the necessary data to policy and decision makers, all while working extra hours with a shortage of personnel protective equipment on the job and no economic shield for their own survival. So let us be clear. Sick, burnout, or anxious health workers translate to increased disease transmission, reduce access to all other services for those with essential non-infectious healthcare needs, erasing the hard-earned gains for the Millennium Development Goals and limiting progress toward the Sustainable Development Goals. The health and economic security of the continent calls for an ever-increasing, highly productive and protected pool of health workers engaged in all aspects of healthcare, from specialized patient care to the provision of community healthcare. Before we begin, I would like to take a moment to acknowledge the efforts of all of the world health workers who are on the front lines, fighting to save the lives of those suffering from illness and disease, including COVID-19. Your courage, dedication, and fortitude are remarkable beyond measure, and we thank you for your continued service to improve the health and welfare of those in our communities and around the world. Next slide. Our agenda today will start with Dr. Yewande Alimi, our esteemed colleague from the Africa CDC, who will provide an overview of the Africa CDC strategy to fight the COVID-19 pandemic and its recommendations on keeping health workers safe. Then we will hear from Dr. Yolan Ijazi, Jhpiego Country Director from Guinea and President of Guinea COVID-19 Scientific Commission, who will speak to the important role partners play in ensuring access to continued health services in the face of the challenges posed by the current pandemic. Next, we will hear from the State Minister of Health for the Federal Democratic Republic of Ethiopia, His Excellency Dr. Dereje Duguma, who will share guidance on the government role in providing knowledge and resources necessary to keep health workers safe as they perform their duties. Our last presenter, Margaret Odera, a community-based health worker from Nairobi, who provides care to women infected with HIV, will provide us her unique perspective on the challenges of continuing community-based care on the front line during a pandemic. Finally, we will wrap up with a question and answer session where I will select some of the questions posed by members of our audience for further discussion. Next slide. Before we start, I would like to make a few announcements. Today's webinar is being recorded and will be made available for future viewing through links posted on the Africa CDC and Jhpiego websites as listed on the screen. We welcome you to submit any questions you have for our presenters as we progress through our agenda today. You can submit your questions by clicking on the Q&A icon located in the middle of the Zoom toolbar at the bottom of your screen and typing your question in the box provided. We will be monitoring the Q&A box throughout the presentations. I will use these questions to moderate the discussion during the last 10 minutes of our program today. Next slide. I would now like to introduce our first presenter, Dr. Yewande Alimi. Dr. Alimi is the Antimicrobial Resistance AMR Program Coordinator for the Africa Centers for Disease Control and Prevention, CDC, Africa Union. She co-chaired the Infection Prevention and Control section for COVID-19 response. Dr. Alimi is a trained veterinary surgeon and holds a master's degree in public health from the University of Nottingham in the UK. Drawing on a range of experience, including veterinary medicine, public health policy, and research, Dr. Alimi currently leads the implementation of the Africa CDC framework for AMR control in African Union member states and co-lead the African Union Task Force on AMR. She also leads One Health activities and development and implementation of One Health programs within the Africa CDC across the African Union organizations and in member states. She is also the One Health technical advisor for the Global Emerging Pathogen Treatment Consortium. Dr. Alimi, I turn it over to you.
Thank you very much, and thank you very much to my esteemed panelists and to colleagues at Jhpiego for working with us to host this webinar. And thank you to our participants who have joined in today. Today, I'll be speaking about the role of Africa CDC in the fight against the pandemic, highlighting some of the things that we have done in terms of protecting healthcare workers and fortifying the health system. Next slide, please. In this slide, this is the epidemiologic situation in Africa as at yesterday, 6 p.m. Africa has reported 147,874 cases. We have a 42% recovery rate. Looking at the numbers, we have over 60,000 recoveries in Africa. In terms of death, across our 54 African Union member states, we have reported 4,230 deaths. Next slide, please. This slide gives a breakdown of cases that we can see across the 5 regions in Africa. Like I mentioned, out of the 55 member states, 54 of our member states are currently reporting COVID-19 cases. From this slide, you would see that the highest reported case is Northern Africa, closely followed by Western Africa and Southern Africa. Next slide. In terms of our role as Africa CDC, what we have done is earlier this year, around February, we had an emergency meeting of the ministers of health of our 55 member states. This emergency meeting was on the strategy, the African-wide strategy for preparedness and responding to COVID-19. This meeting was attended by experts from across the continent, WHO, Afro, and EMRO colleagues. During this meeting, the ministers of health agreed to set up the Africa Task Force on Coronavirus, which we call the AFCO. Next slide. So this slide just highlights the key achievement of the Africa Task Force for Coronavirus. To date, we have 7 working groups. Looking at surveillance, for example, one of the strategies that we have done is training on enhanced point of entry surveillance and event-based surveillance. So far, we have released Africa-specific guidance on contact tracing, physical distancing, meetings, guidance for travel industry, and daily we upload epidemiological data, which can be found on our website, www.africacdc.org. In terms of supply chains and stockpiles, we have distributed over 1 million laboratory test kits and IPC supplies in collaboration with the Jack Ma Foundation. We have also stockpiled surveillance, PPE, and laboratory medical supplies in our regional hubs to better support our member states. For laboratory diagnosis, we have trained over 48 countries on PCR testing, and we are continuously distributing test kits to our member states. Our clinical management team have developed what we call the online clinical management hub, where we have over 4,000 registered clinicians across the continent that meet weekly to update guidelines to learn about case management and improving case management. In terms of infection prevention and control, we have physically trained over 40 countries on IPC and recently launched our IPC webinars, where we have trained about 2,500 healthcare workers on IPC measures for COVID-19. We have also developed Africa-specific guidance on community use of face masks and PPE. As you know, risk communication is equally important, and we are continuously training member states through our online platforms on strategies for risk communication and community engagement. Our science, standards, and regulation team have been looking at models predicting the epidemiological estimates of the outbreak in Africa and developing analysis for impact of physical distancing on case growth. Next slide. In the next few slides, I would just highlight some of the strategies that we have done, particularly because I'm representing the IPC Technical Working Group and what we have done for healthcare workers across the continent. Immediately, Africa reported the first case early in February. What we did was immediately start working on capacity building for our member states. In February to March, we trained over 80 people, 80 IPC experts from 40 countries, where we did that in Abuja and in Abidjan. We've also developed country-specific technical assistance on quarantine and IPC protocols. One of the challenges that we faced and we had to adapt to is as many cases were popping up across the continent, countries started to shut their borders. So what we decided to do is creating a remote comprehensive support for IPC experts, healthcare workers through our webinar series and our community of practice. Next slide, please. This is the overview of the countries that have benefited from the IPC trainings that we have organized over the past couple of weeks. We have trained over 2,500 healthcare workers from 59 countries all around the globe. One of the strategies that we are using is having experts available in our community of practice to provide on-site support remotely to healthcare workers, particularly healthcare workers faced with African-specific challenges. Next slide, please. We understand the need for strengthened public health workforce across the continent. And this just highlights some of the things that we have done in terms of deploying rapid responders of varying expertise to over 12 countries. And we are looking at ensuring that we're able to deploy many more rapid responders and experts to various countries to support their response for COVID-19. Thank you very much.
Great, thank you, Dr. Alimi. You gave us a great overview of current strategies and activities employed by the Africa CDC to ensure protection of frontline health workers to provide essential and critical health services during this pandemic. Thank you very much. Next slide. Next, we will hear from Dr. Yolan Ijazi, a Jhpiego colleague for nearly 25 years and current Jhpiego country director in Guinea. Dr. Ijazi was recently named president of Guinea COVID-19 Scientific Commission. She will lead 17 colleagues as they advise the government on strategies, priorities, and resources allocation in response to the COVID-19 pandemic in Guinea. Dr. Ijazi is also a professor of obstetric and gynecology at the University of Conakry and former vice dean for research at the medical school in Conakry. As country director, she played a key role in assisting Guinea health system during the Ebola crisis to ensure that women and families in West Africa received high quality services. Please go ahead, Dr. Ijazi.
Thanks, Alain. Good morning, good evening, good afternoon, good evening, everyone. It is our pleasure to present on the role of partners safely providing essential services during a pandemic. In other words, how we can support countries to ensure continuity of essential services in order to avoid unnecessary death. Before discussing about how to support essential services, let me define which are these services according to WHO operational guidance for maintaining essential health services during an outbreak, which was out on March 2020. These essential services are defined, identified, and to support countries, strategies shifts are required to ensure that increasingly limited resources provide maximum benefit for a population during epidemic. And these services are immunization services, reproductive health services, including pregnancy and family planning services, support to vulnerable population, management of inpatient services, and also providing auxiliary services such as diagnostic and laboratory services. Slide, please. Beyond its direct effects on mortality, there is a rising concern that the COVID-19 pandemic will disrupt the provision of healthcare services globally, resulting in an increase in the number of deaths from COVID-19 causes, from non-COVID-19 causes. According to a global financing facility rapid survey of 36 countries and Good Matches research team, there will be nearly 50% service disruption. Additionally, 49 million women with an unmet need for modern contraception, 128,000 maternal deaths, and 168,000 newborn deaths. And also, other services will be impacted greatly. Slide, please. For all actors, including partners, it is imperative to act and support countries now. Countries will need to make difficult decisions to balance the COVID-19 response with coordinated action to maintain essential health services delivery. For that purpose, WHO has released high-level guidance for maintaining essential health services during an outbreak. This guidance has to be contextualized according individual country needs and situation. Here are the priority areas that countries should work on. Develop governance and coordination mechanisms, identify context-relevant essential services, optimize service delivery setting and platforms such as telehealth, establish effective health workforce and patient flow at all levels. For example, reorganizing waiting area to allow for distancing, rapidly redistribute health workforce capacity, develop mechanisms to maintain availability of essential commodities, equipment, and supplies. This presents an unprecedented opportunity to reinvigorate health system, strengthening measures that prioritize decentralized, community-based, and client-focused mechanisms for accessing health information, services, and products. Slide, please. How partners can support government effort to implement those strategies? In this effort, partners position themselves to supporting countries financially as well as technically to ensure continuity of services. It is essential to adapt the WHO guidance to develop service delivery guidelines which help to ensure continuity of these essential services. This support will require technical updates, providing equipment, especially infection prevention and control equipment and material, including putting in place a triage system, and also involving community health workers in this effort. Partners should support reinforcing public-private partnership also, and coordination at all levels to ensure synergy and monitoring are key components for success. The support should also focus human capacity development. And this is the moment to think differently about how to train healthcare workers and community health workers. When they are travel and gathering restriction, using webinar, video, etc. should be explored. Another option is on-site training, where the trainer mentors can work with providers in their everyday context using hand-on techniques, simulation, getting away from taking providers out of the facility for training. Slide, please. While implementing these different strategies to support countries, we can encounter some challenges and we need to anticipate solutions as much as we can. Some of the challenges are communication gap or absence of coordination among all actors, Ministry of Health, partner, etc. As I mentioned on the other slide, coordination is key for success. So we need to work toward that. Other challenge is insufficient essential commodities and material worldwide. Supply chain slow down due to closure of factories and borders. To address these challenges, partners need to coordinate effort to minimize risk. Another point is health providers with high rate of infection. For that, appropriate information and making available personal protective equipment in sufficient number will help. Other challenges are community afraid of coming to health facilities, restrictive measures to contain infection, preventing the community from coming to health facilities. To address these two challenges, health education session of community by involving community health workers is one of the solutions. Before closing this presentation, I would like to reiterate that the role of partners is to support countries in this difficult task and preserving the health of the population through the maintenance of supply of essential services despite the urgency of pandemic. And to be effective, this technical and financial support from partners must take into account the real needs of countries and benefit from strong coordination of intervention. Thanks for your attention.
Thank you, Dr. Ijazi, for your informative presentation. As you noted, partners need to coordinate efforts that build on each other's strengths if we are going to make any advancement in getting the upper hand on controlling this pandemic while keeping healthcare workers protected and safe. Moving on, our next presenter, His Excellency Dr. Dereje Duguma, is the State Minister of Health for the Federal Ministry of Health in Ethiopia. He's currently leading the effort for the continuation of non-COVID-19 essential services and providing regional support to fight the COVID-19 pandemic in Ethiopia. Prior to his appointment, he was the Bureau Head and Manager of Health Promotion and Disease Prevention for the Oromia Regional Health Bureau, or the ORHB. Dr. Duguma solidified his reputation as a health systems expert when he and his colleagues from the Oromia Bureau identified poor data quality as a main obstacle to planning. Specifically, the team gathered data, accurate, reliable, timely, and complete data was hampered by a lack of attention, awareness, and commitment from managers. Once Dr. Duguma and his team identified these causes, they were able to create specific action plan. So to this day, Dr. Duguma advocates for more data training and encourage continuous coaching for health professionals. Please go ahead, Your Excellency. I don't think we have His Excellency, Dr. Duguma online. So I'm going to move to.
Thank you.
Okay. Well, I think Dr. Duguma, you can go ahead.
Yeah, I think you can you hear me now?
Yes, we can.
Thank
Yes,
you.
I can hear you now. Please
Thank
go
you,
ahead.
thank you. So yeah, so there may be some network problem because I'm very far from the capital city, from Addis now. I'm in Gambela region, one of the remotest region. So almost now I'm at the border of Ethiopia and the South Sudan, and I'm just with a team from different ministries to look on the progress that we have made in the fight against COVID, and also the progress of non-COVID services. So I can say some issues and some progresses that we have made over the last 2 to 3 months. So specifically about the topic that you want to speak on it, about the protecting healthcare workers. So I mean, I can say a lot on this topic, especially this time we are dealing with a pandemic, in which we are learning about the pandemic every. But as healthcare workers are very essential at this time, and they are doing all their best to put their lives on the line. We need to take measures to really actually motivate and encourage our health workers in the best way possible. So far in our country, we did a lot to improve the motivation and the engagement of our healthcare workers to fight the COVID pandemic. So the first major the government take was to establish health insurance for all frontline workers. So with the insurance scheme we have in the country, we have already signed a memorandum of understanding with our insurance company in Ethiopia to establish the scheme for frontline workers. So this is basically the insurance scheme will benefit those healthcare workers which are frontline that deal with COVID issue day to day. So it's a life insurance mode. So I think that's one of the most important decisions that have been put by the government. The second important decision that the ministerial cabinet made just two weeks back was to develop an incentive package that have been endorsed already by the ministerial cabinet, and now it is being distributed to all health facilities and all to regions in Ethiopia. As you know, we have 11 regions in Ethiopia. So all regions are semi-autonomous, and they are really cascading the incentive mechanism, and they are trying to pay for frontline health workers. So every healthcare worker that deals with pandemic every day will get additional incentive, some incentive mechanism. Actually, it's not that much big incentive, but I think it's one of the most important things that we need to do. So I think that's one of the important issues that we did. And now the health workers are a little bit, I mean, they liked what we decided, but we need to further increase the amount of allowance. But this is one of the most important things we really did. The other thing is we needed to highly prioritize our infection prevention control in facilities across the country to make sure health workers are not infected while working. So specifically, the donning and the doping mechanisms are well put in all health facilities. The PPE materials are, we know it is, as already said, there are shortage of PPE materials, but as much as possible, we are trying to avail, and we have already prioritized the treatment and isolation areas to get as much as possible the necessary PPEs, and actually we are progressing on that line through donation and through purchasing from different other countries, especially from China. We are getting a lot of PPE materials, and also in the countries there are some big industrial parks that already started to produce PPE materials, and we are now currently distributing these materials to the most needed areas. And there is state of emergency in Ethiopia, and we are protecting the health workers and the health providers and also health facilities to have the needed amount of PPE materials. So far, we have really did very good on these areas. And the other most important thing that we are working is about mental health. So mental and psychosocial support to healthcare workers, and also that extends to actually the community as well. That's also going very, very well. And also tried to have really a hotel or a building that is not far from health facilities, and the healthcare workers are not now going to their family. So at all places, they have their residence area. We have a guideline on the residents, and the staffs will not go to their house. So they will get the benefits around hotels. This is the other important thing that we really did. The other thing is, as it's known, COVID-19 has made a disruption to every facet of life, including the demand on health workers to provide safe care for COVID-19 patients, while all other non-COVID-19 care still needs very high attention. So we are, as Ethiopia, we are trying to balance these competing priorities to meet the needs of both. You know that in Ethiopia, there are lots of communicable and non-communicable diseases, so they need attention as usual. And also the COVID-19 has made really a very challenging situation to treat the non-COVID services. So what we did was during the very first week of the first few cases around March 13, there was really a huge disruption of health services in all health facilities in all region because of the panic attack everywhere, even in the leadership, health facilities everywhere. So the community thinks that almost all the other services has been stopped to be served in health facilities. So the community really stopped to come to health facilities. But what we did was we produced an interim guideline based on WHO. So the interim guideline basically gives a power to health sector to give all the essential non-COVID services that almost focuses on maternal and the child health care, family planning, specifically antenatal care, skilled birth attendant, immunization services, and emergency maternal and newborn care have been included in the essential health services. So treatments for and the non-communicable disease, specifically TB treatment, malaria treatment are the major initiatives and activities that have been included in the non-COVID services. And also trauma and emergency services have been part of it. So this, we really cascaded. We give virtual to our healthcare workers in almost all hospitals, and we cascaded the interim guideline down to health post level. So even in the health post level in Ethiopia, we have 2 health extension workers, and one of the health extension worker will focus on COVID service. The other health extension worker will give services in health post, specifically immunization, the family planning, and other basic services. And then later, we also we evaluated the implementation of the non-COVID essential service, and later we have tried to improve the guideline, and the second version is now titled COVID essential services, and then it's already again cascaded to the health extension and health provider level down to our waradas and the Kabali level. So I think now the improvement is markedly already seen in almost all hospitals and health centers. Now the non-COVID essential services are being rendered. Especially this time, I'm in one of the most remote hospitals in Gambia, and I've seen that for 1 to 2 months, there was really decreased services of essential services. But now I think we are almost back to the previous before COVID level in almost all services. So currently we are also doing active case search from home to home, and almost more than 60% of the population have been reached for the COVID services, home to home active case search. So while cascading this home to home we are communicating with households and our communities to come to health facilities for immunization and for any activity. So our community is now coming to health facilities to give to get the service. And currently from the ministry and from different partners, we have a lot of teams that went down to health facilities and the community to see the progress of the non-COVID services. So there is integrated support supervision, and I'm also part of the integrated support supervision, and we have seen really important changes on the ground. But this needs to be seriously done from time to time. As you know, in Ethiopia now, even though the cases are increasing, but actually the cases are not that much very high like other countries, about 1,200. But we have to really keep our eye wide open on those non-essential non-COVID services. So far, it's very good. We are being very good on the non-COVID essential services, and the protection for healthcare workers also doing very well. I hope we continue like this. So if there are any questions, I will come back if my network is good. Thank you very much.
Thank you, Your Excellency, for sharing with us your experience on what is being done in Ethiopia to combat the spread of COVID-19 and the resources you are providing to educate health workers on how to stay safe as they perform their duties in delivering essential and critical care to all those in need. We can all learn from the successes of your efforts in Ethiopia. Next slide. Our final presenter, Margaret Odera, is a community health worker and mentor at the Mathare North Health Center located in her neighborhood in Nairobi, Kenya. Margaret spent her days mentoring HIV-positive mothers who are either pregnant or lactating and monitoring their progress to ensure there is no transmission of HIV from mother to child until the baby reaches the age of 18 months and is HIV-free. As an HIV-positive woman with an HIV-negative husband and 3 HIV-negative sons, Margaret serves as a role model to all of her patients on how women living with HIV can thrive with access to essential health services and education to ultimately lower the HIV transmission rate to 0. So please go ahead, Margaret.
Okay, thank you very much, participants and all the viewers that we are here together. And I'm going to start by saying that we started sensitizing the community on the dangers that are looming in our country in early March. Since my immunity system and the mothers who are HIV positive immunity system is compromised, so we started from there. So that this was an initiative of protecting ourselves and protecting the other people from the COVID-19. So we started by sensitizing the mothers so that they may protect themselves. Another initiative that has been taken in the facility is the fumigation. The facility has been fumigated twice a week from March. Since the first case was recorded in March, the fumigation of the facility has started taking place twice a week from March. And then we have also continued sensitizing the community and the mothers at large on the dangers that are looming even in our community. Because even right now, as I speak, we had on 28th of May, we had a community testing of COVID-19, and we already had 13 positive cases around my neighborhood. And we have 69 deaths in the Kenya region, the whole country, and 2,027 people have already tested positive. But in my small area, we already have 13 positive cases. So we started by, sensitizing the community, going to house to house sensitization before the house to house was stopped, because that was an initiative to protect me as a health worker and also to protect the mothers who are outside there. So the initiative that has been taken was to stop going to the household, visiting the household meetings, the household visits. And what we are doing right now, we just mentor the mothers through phone calls. We give them the psychosocial support through phone calls. And from the month of March, we were giving them the return dates of a bit longer, around 3 months, to come after every 3 months if the baby is not being immunized. And I think those were the initiatives that were taken so that we may also protect ourselves because of the crowding, to avoid the crowding of the facility. And then in the facility itself, the management were providing us with masks, though they were not enough, but every day the management made sure that each and everybody has a face mask. and a sanitizer in each and every room. Since my room is a PMTCT room, the Prevention of Mother to Child Transmission room. So we have been provided with sanitizers. We have been provided with gloves, and as we continue with this, we have tried to avoid overcrowding of the mothers in the facility. So we take in as a few mothers, as 15 women per day. In every day we take 15 women, and we ensure that the mothers who come are provided with enough ARVs to sustain them for 3 months, and then we make a monthly, we make the monthly mentorship and psychosocial support through phone call. Another initiative that has been taken is a hand washing. At least right now, we have more stations of hand washing in the facility, and also in the community. We have seen a very much improvement. People have started washing their hands, and the first cases, the first times that we were going to the community, there was a lot of resistance. But right now, since they have started deaths and the positive cases have started being manifesting, the community have started taking this initiative very seriously. So we have taken the initiative, you protect me as I protect you. So as we speak to the community about wearing face masks, there is nobody who is allowed to enter in the hospital without a face mask. And those are the initiatives that we have taken we have taken as community health workers and as a community mentor mother. Since our immunity system is already compromised, we also taught them about taking care of themselves, the personal hygiene. We teach them about nutrition, and even when they are at home doing exercise. And the facility in charge has also provided the community health workers with thermometers, so that when we come to found a suspected case, we have thermometers in our hands. But the going to houses have been stopped, and overcrowding. Okay, those PSSGs, we have stopped the activities of putting the people together to putting the people together to avoid overcrowding. So social distancing has also been encouraged in the community. And because we also need those children to come to the facility for immunization, because immunization is also important to ensure that the immunity of these babies is also high. We encourage these mothers to just come for the immunization in their dates of immunization and just go home and just go home. And we have stopped doing the psychosocial support groups in the community. So those are the initiatives that we have taken right now, and we have seen a lot of positive outcomes in the community. Right now, as you walk in Mathare, you will not find anybody without a mask. And also the police, the government has also, chipped in to even give us support because of the resistance that we were facing during the first days. So the police just go around to make sure that everybody has a mask. And yes, and the challenges that we are facing right now is a lack of water. We still don't have enough water in Mathare. We are living in a semi-slum area, so we have an acute shortage of water. There is also inadequate sanitizers. We don't get these sanitizers on a daily basis. And then there is this lack of footwear. We don't have the footwears to put on our and on our feet. We just put on our shoes. Though steps have really been taken by the government to fumigate the facility and to provide us with face masks and bring water, but still we have those few challenges. And then the other challenges that we are facing is we have a great challenge when we go to the community. We find people in drinking sprees who have started drinking sanitizers because they have stopped, taking beer, so they have turned to drinking sanitizers. So it has been really a challenge to speak to these people in the community. And for that, I hope that our government is going to do something about it. Thank you very much. I am HIV positive and I am a mother of 3 children who are HIV negative. So another challenge also is I don't have any boarding place as a health worker. We don't have any boarding place to go to. When I just get from the facility, from the hospital, I just go straight to my children and to my husband. And if you have small children, they will just run to you. So this has been a challenge to me as a mother and also as a community health worker to just I don't have any other place to go from the hospital. So yeah, it has really been a challenge to me and to other health workers in the facility. Thank you very much.
Thank you, Margaret, for sharing your personal experience with us on the challenges you encounter on a daily basis while delivering health essentials to the community, especially women infected with HIV. It's important for us to hear about experiences like yours to remind us of the true challenges we face, not just among health workers, but in the overall healthcare system at large, when it comes to preventing further disease transmission and how communities can still thrive in the face of disease and infection. Thank you again for your perspective. Now it's time to ask a few questions. First, just to summarize what I heard, the fight against this pandemic is a multi-dimensional challenge. It involves taking care of supply chains, logistics, policies, behavior change, service delivery, data, human resources, infrastructures, et cetera, et cetera. So one of the questions that keeps coming in the question box is, and I'm addressing this question to our colleague, Dr. Alimi from CDC Africa. How many providers have you trained so far? How many are you planning to train in the future? How are you deploying them? And how do you think, how many do we need in the countries that you are concerned with?
Thank you very much for that question. I noticed a lot of questions in the Q&A chat box sort of reflect looking at who have we been training. So in the capacity of the people that we've been training through the webinar series, we have had high PC focal persons, we've had doctors, nurses, pharmacists rather, and community health workers. And somebody had asked specifically across the continent. So one thing to also highlight is that because of the language disparities, we run weekly for English and French. So in terms of the total number of countries that have been represented in the webinar series, we have had 49 African Union countries represented in those trainings. So we have done, in terms of the webinar trainings, we have really focused on healthcare workers, IPC focal persons, health facility managers to train them on that. And this webinar series is still is ongoing. There's going to be a session tomorrow. We're looking at training up till, running this webinar series up till the end of the year so that we're able to reach as many healthcare workers as possible.
Thank you. This question is for Odera. How do you address, as you work with communities, how do you address the issue of rumors, all the rumors that are going on around the COVID-19 pandemic? How do you correct false rumors that are going around in the community? And how do you help people respect social distancing?
Okay, thank you very much. Okay, these rumors, we have had people who have been infected with the coronavirus, and they have they have now recovered from them. So we give such examples, and we also give examples of death, because the people who died of the coronavirus, some of them, the burial was being aired in the television and in the radio. So we tell these people to just you know, look at the examples of in the televisions and in the radio, because something cannot be aired, a lie cannot be aired in the whole world. So we just tell them to, we just tell them to just take precautions, because this pandemic is real. And when we went for the mass testing on 28th, just last week, and we got 13 people who tested positive for the coronavirus. So this has been really a lesson to them. And then in Kenya, we have really not gotten this rumor that is going on that the Black people are supposed to be killed. I have not heard that. But this is a virus. We tell them that this is a virus like HIV. So I give the example of a HIV virus, because most of the people knew me and they knew how I looked like when I was HIV positive. So most of the time I give example of myself, so that people will take this pandemic seriously. And I also act as an example. I wear a face mask when I walk around, and I encourage people to use water and just to keep clean. And because I work in the health facility, and because the people in Mathare really respect the doctors and the nurses, so yeah, the Crown also gives us a good reputation, so they hear us more. Yeah, thank you so much.
Thank you. This question is for Dr. Ijazi. How are you addressing the shortage of PPEs?
Okay, thank you, Alain. Currently, we know that the shortage of personal protection equipment is a big challenge in almost all the country. So partners have to ensure coordination. I can give you an example. In Guinea, you know that USAID can't purchase PPE, but we know that World Bank and the Global Fund have the opportunity, and the United Nations institution have the opportunity and the facility to purchase these PPE. So we are doing a good coordination to see who can purchase what, and how this coordination can help the countries to have a sufficient number for all providers in the health facilities and all community health workers also, because we have to protect the provider in the facilities and the provider at the level of the community. Thanks.
Thank you very much, Dr. Yolan Ijazi. Another question, I understand the state minister had to go to another meeting. So I'm asking our colleague from CDC Africa, what are some of the effective ways that the lesson learned about your training and what you have done with previous epidemic before in terms of infection prevention and control? What have you learned that can be applicable by the various countries that are trying to address the training of healthcare workers in infection prevention and control? Some of the lessons learned from your team.
Thank you very much for that question. I think one of the things that we have learned in previous outbreaks, looking at Ebola, looking at the global threat of antimicrobial resistance, is that we recognize that many countries need to have public health capabilities in countries. Looking at national public health institutes. So one of the things that we have been working with countries is improving the infrastructure, the enhanced capacity for integrated national networks for disease surveillance, laboratory networks, emergency operating centers, and innovative information systems. Another thing that we have learned is more and more, we need to strengthen the African public health workforce, looking at adapting and engaging community health workers, field epidemiology training programs, and we've been doing that with our Workforce Development Institute here at Africa CDC. And that's why we have been able, so we have a roster of rapid responders experts. In my presentation, I highlighted that we have deployed over 140 experts to over 12 countries. And this is because we have a roster or a database of experts that we can always rapidly deploy through our AU mechanisms. I think finally, I would just like to highlight that more and more countries are beginning to see that there is a need for a strong commitment to enhancing systems for health, to strengthen health systems, and it's impossible to do that without some sort of political commitment. So for us as a technical agency sitting in a political agency, the Africa Union, one of the things that we have been doing is high-level political advocacy. We did that, as you may be aware, during the Ebola outbreak. Very recently, the heads of states and government endorsed a common position on antimicrobial resistance. And in my slides, I highlighted the role of the ministers of health endorsing the strategy that Africa CDC is using to respond to COVID-19 across the countries. Over.
Thank you very much. I would like to thank all the presenters for taking the time to join us today, sharing the expertise and perspective in participating in such an engaging discussion. I want to thank the members of our audience for giving us an hour of your time. We hope you found the content presented valuable and that you leave us today energized with new information that will keep you safe and protected as you provide care during the COVID-19 pandemic. Stay safe, stay well, and thank you all again for joining us.